We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and increasing here in Florida, this leaves many residents questioning what we should do next. Face masks are still required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our local medical professionals, and joining me is Dr. Thomas Prince, Medical Director with the Florida Department of Health in Orange County, and he is joining us from the Orange County Convention Center. Dr. Prince, thank you for being with us today.
It's a pleasure. Thank you for having me today.
And Dr. Prince, tell us about the procedure to get a vaccine at the Orange County Convention Center now.
Okay, well, the first thing that somebody needs to do if they want to get a vaccine here is they should be in the proper group of individuals. Right now, we're limiting our vaccinations here at this site to people who are 65 years and older. And if they fit into that group, then they should be able to get a vaccine. What they would do is then go to our website and they would then enter the application to register. They can register online, and they answer a number of questions about their health history, and they will get an appointment to be seen here, and they'll get a response back. They'll get a special code. By the way, I want to make a point of this. They get what's called a QR code, which is that funny looking code that's a square looking thing with the kind of a maze in the center. We've had some issues with people registering and only getting the barcode, which is the one that's got all the bars. It's a rectangular shaped thing, and that you want to make sure you get a QR code. Once you've got that and you've got your appointment, you just show up about half an hour beforehand here at the convention center. They'll let you in up there. They'll check and make sure that you have the correct QR code. They'll make sure that you have an identification. They'll send you down, and there's usually a little line. We're coming. We have appointments starting on the hour generally, and we'd like to have people come no sooner than 30 minutes beforehand because we really can get too crowded here. They would then come in through the line, and they meet at registration where things would be confirmed. Then they would go. The line is then split up into two lines, and each of those lines then proceed through the area behind me here, and they're split off into the nursing stations. And once they get into the nursing station, the car will park, and they turn their engine off, and the nurses and the assistant will come out and ask questions, some of the same questions we had before, and all their information will be available, and we'll go ahead and see if we have anything that they're worried about. We'll find out whether they need anything in particular. We'll go ahead and give them the vaccination, and then right after that, they'll drive right from the area back here through this way out to the parking lot area where we have people stationed out in the parking lot who will observe them for about 15 to 30 minutes, depending upon whether or not their medical history indicates that they need more or less observation.
That's great. Thanks for giving us that information. And you know, the coronavirus infection numbers are growing in Florida and in Orange County specifically. Two questions for you. Are we in another wave? And what are the implications of the growth of that in those infections on our health system here in Orange County?
Well, I would say yes to the wave thing. Whatever it is, we're certainly getting a large number of new cases, as you're aware, Clarence. And we believe a lot of that has to do with the holidays where people were a little less vigilant with their social distancing and masking. But we definitely are in a time of climbing numbers. And we hope that some of the things that we're doing now will bring this back down under control. Right now, we have our healthcare system is fortunately for us, we just aren't suffering like some of the other states are. We're definitely beginning to push up our limits on the number of beds and so forth we have available, but we haven't gotten anywhere near a critical concern at this point in time like they have in California and some of the other states. I guess we've just been very lucky about that. And we certainly don't want to push our luck on that, because eventually, if we don't get these numbers under control, we will have to get some of the things that are going on out there and some of the other states where they might be rationing ventilators or ICU beds and so forth. I certainly hope we don't get there.
Absolutely. And we're hearing about the discovery of at least one variant of the coronavirus. Can you talk about that, and are we seeing it here in Orange County as well?
Well, to answer the end of your question first, we have not had reported at this time the variant here in Orange County. But I could say that right now, and maybe in a laboratory up in Tallahassee, they've confirmed that. So I expect it to be any moment, quite frankly. And the truth is there are probably multiple variants of the COVID virus out there, but this one in particular that was first identified in England and then later seen in Colorado and other places in the world, that particular variant has an ability to transmit from person to person much more rapidly than the normal coronavirus has. Even though the normal coronavirus has been, it's been like a little fire, it catches on pretty good. This is more like a wildfire on a dry day with the winds blowing. This thing can really go. And it's not more virulent. In other words, it doesn't hurt people quite as, any more than the other one. But the fact is, if you get more people sick, and you're killing 1% of them anyway. So you get a small number of people sick and you kill 1%. That's not good. But then you get with this new virus, it's much more easily spread. You maybe get 3 times the number of people sick, and you kill 1% of them, and you've killed more people. So it's concerning, and it could put more pressure on our healthcare systems. So at this point in time, there's not much we can do about it. Keep vigilant, and we need to keep the same precautions that we've always kept: the social distancing, the hand washing, and the masking. And of course, it appears at this time we don't have any reason to believe that the vaccine appears to be protective of this one as well.
And we know that the convention center is being used to distribute the vaccines, but how and where else in the county are vaccines being distributed? And if you could just reiterate a little bit of the procedure in order to make sure that people know how to get their loved ones, if they're over 65, ready for a vaccine.
Last I checked, the only 2 people, the vaccine originally came into town. It was being distributed through our major hospital system, Advent Health and Orlando Health, to their employees and practitioners and so forth. Now, I've subsequently seen where Orlando Health has gone out and beginning to vaccinate over 65. For us, we have to stick with the state guidelines, and we are currently doing 65 plus. So I think that in terms of getting numbers, if you have a family member who works at Orlando Health, then they should be looking into getting their families vaccinated. There, I'm talking again the elderly. And if you're not, I think that you would try and go through our site. We've recently increased our numbers from 1,500 vaccines a day to right around 2,000 a day. So we're doing our best to do that. There will be other places opening. There's no question about that. And again, there's always the possibility. I haven't heard anything about Advent, but I wouldn't be surprised if they were opening something any moment.
All of the attention is on the vaccine for over 65. But for everybody else right now, is it still important for us to get a flu shot as well?
We're lucky in one way that the flu has not been as bad as it can be. That said, just because we haven't had a bad flu season, and that may be because of the social distancing and the masking, because it protects as well there. That said, it's still wise to get a flu shot. We still haven't hit the peak of the flu season, which should be sometime next month. So I would advise people, yes, definitely go get a flu shot if they can. Yes, sir.
Well, Dr. Prince, thank you so much for being with us, especially from literally the front lines of this pandemic and
Yeah.
keeping us informed. We appreciate your work.
Yes, sir. My pleasure.
And we'll be right back with more. Stay with us. Ensuring residents of long-term care facilities receive a COVID-19 vaccine is a top priority here in Florida and throughout the United States. I've asked Tom Rockenbach, the executive director of Westminster Winter Park, to share how this vaccine rollout is progressing. Tom, thanks for being with us.
Thank you. I appreciate the opportunity to share.
Tom, first of all, let's talk about the medical side of the nursing home industry. Tell us about that.
Okay, so the nursing home industry is quite complex in the medical world. We have 2 nursing facilities on our campuses here, and we engage in everything from recovery of knee or hip replacements to long-term issues recovering from strokes, and then of course just dealing with the complexities and multiple issues of health for residents as they age. We have physical, occupational, speech therapy, as well as ensuring that the residents that are among us have the best quality of life that they possibly can during their stay here.
And you know, as the COVID-19 vaccines roll out, why is it important that the nursing home facilities are in the front of that line?
Well, as you well know, the folks that are in nursing homes are our most frail individuals in society. They have many comorbidities and challenges, and they need that protection as quickly as possible.
Yeah, you know, there's so much information out there, and you are sort of the beginning of the rollout of the vaccines. How are nursing homes getting the information about the vaccines?
So we have a number of different resources that are sharing information with us about the vaccine. Locally, the local departments of health are sharing information. In Florida, we have the Agency for Healthcare Administration, who is doing a large part in helping to move the vaccine around through the various health systems and pharmacies that are working with us. So our particular organization, we are working with CVS Pharmacy to obtain the vaccinations for our folks here. Walgreens is another big player in the state right now, and there will be others coming online.
And have all of the residents of Westminster gotten their vaccine so far?
So we've been very fortunate. We have conducted our first clinic at the one campus on the 4th. This is Monday of this week, and our campus here in Winter Park on the 5th. And we have about a 96% acceptance of the residents of the nursing facilities, which is very high. And we've also been able to vaccinate a number of our staff.
And how are you working with the families of your residents to make sure that they're informed about what's going on with the vaccines and their loved ones?
Yeah, so it's very important. The vaccine is, in order to receive it, there is a consent required. So we're working closely with family members of our residents who may not be able to give us that consent directly. We've been communicating with them via email, text messages, and telephone calls where necessary. We are very pleased with the support that our family members have rendered to having their loved ones being vaccinated.
Now, once all of the residents are vaccinated, will you start to relax the restrictions on visitation?
Well, at this point, there's still a lot of unknowns with the vaccination and the efficacy and how long that will be. So we're going to be continuing to look towards the direction of the CDC as well as our local state Department of Health. As far as our organization is concerned, we will continue to wear masks and protect one another, even though we've been vaccinated, until we have a better understanding of what the results of this vaccination will be.
Now, Westminster has an essential caregiver program. Tell us about that.
We do. The Essential Caregiver Program is really a godsend. It's an opportunity for up to 2 individuals per each resident to be able to become certified, if you will, as an essential caregiver. They need to share with us a reason for that essential need that the resident may have. It's simple. It does not have to be a complex medical need that those individuals are fulfilling. It could be something as simple as being there for the comfort of my loved one. So they register with us. They go through a brief training program on how to work their personal protective equipment and the things that they need to do while visiting their loved one here in the nursing home. While they're here, they do wear the personal protective equipment that does include gowns, masks, and gloves. They visit directly with the resident. But prior to the Essential Caregiver Program, there was no opportunity for loved ones to come into the facilities and visit with their loved one. It had to be done through a special visitation outside for a very limited time.
It's all about making sure that our elders are happy and healthy. Tom, thank you so much for being with us today and letting us know about the rollout of vaccines in our long-term care facilities. We appreciate you.
You're very welcome. I appreciate the opportunity to be with you. Have a great day.
You too. And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe, everybody.